We would like to welcome you to Warwick Hospital Maternity Services. During your antenatal or immediate postnatal period, you may need to visit our Maternity Assessment Suite, which is also referred to as MAS. You will visit here if you have concerns about you or your baby's health and well-being. In MAS, we have a triage system in place. This helps us to prioritise the safety of women and babies in our care and allows us to treat the women who need urgent care first. When you arrive in MAS, you will be checked in at our reception area, you will be welcomed and provided with a pot to do a urine sample as part of your initial assessment. We aim to see all patients within 15 minutes of their arrival time to complete initial observations and your assessment. For your initial assessment, we talk to you about your symptoms, check your pain score and do your blood pressure, pulse, oxygen saturations, respirations and temperature. We will also have a feel of your abdomen to check your baby's presentation and listen to your baby's heartbeat. Based on these findings, you'll be categorised into red, orange, yellow or green. This is similar to a traffic light system, with red being the most urgent and green being the least. Patients who are in the red category will require urgent transfer to labour ward. Orange is where you'll be seen within 15 minutes for a full assessment by a midwife or doctor. Or if you've been categorised as yellow or green, with these you may be sent home or referred to your GP, or if further assessment is required, you'll be seen by a midwife or doctor within 1 to 4 hours. The initial assessment should take around 5 minutes. At this point, you will know what is happening next and who you'll need to see next. All information will be passed on to the next staff member. After the initial assessment, you may be asked to return to the waiting area before you have further investigations carried out. If your situation changes during this time, then please let a member of staff know. If further investigations or an examination is required, you will be invited to the maternity triage room. Reasons for your assessment in MAS may include abdominal pain, antenatal bleeding, raised blood pressure, a change in your baby's movement pattern, ruptured membranes, suspected labour, postnatal concerns, you feel unwell, or have other concerns not mentioned. We want you to feel welcome, important, understood, and comfortable when you visit MAS. You can bring someone with you, and we encourage you to ask questions if you're unsure about anything during your visit. Depending on your reason for MAS, you may have to have a CTG monitoring, bloods taken, vaginal examination, or other investigations. You will have the results of most of these during your time in MAS. For results of tests that take longer to come back, you'll be contacted at home if there's any further treatment or follow-up required. All of your tests and results will be reviewed and a plan of care will be made in a joint decision with you. Depending on follow-ups required, you may need to be admitted for further observations or discharged home with follow-up through our antenatal clinic, antenatal assessment unit, or your community midwife. Once you have left MAS, if you have any new or continuing concerns, then please contact us to come back for a review. We're open 24 hours a day, 7 days a week, and are here to listen and to check any concerns that you might have.